We had 9 days of all of us together, and we used that time really well to build their perspective.
What I liked most was that a woman who had undergone violence was given all the possible facilities under one roof, and that was a hospital. And many of them were run in coordination with NGOs, and NGOs have got tremendous potential. Then I think it would be one of the best ventures.
In the beginning, there was a lot of formality between the NGO and the government. I was able to do things that the NGO could not have done, which is equalizing some of that, the dynamic between the NGO, the government, and the funder. I think the government officials were quite surprised when I addressed them by their first name, or when we said, let's all go out together.
We all together went everywhere, and we all learned together. On the last day, all of us sitting together, and one by one we discussed what we found, what are we going to do about it. And we actually criticized also each other. Amar and Geeta, both of them were there. So it has really helped us, because we were that day itself clear our roles. We knew that who has to do what, and we felt it's our project.
Well, after coming back, it was very easy. A framework of it was prepared. We went to see the higher-ups in the municipal corporation on the same day. And we have to explain the strategy, saying that we start on an experimental basis in this hospital for 2 years. At the end of 2 years, you yourself do the evaluation, see how it is working, and in future how it could be integrated into the BMC's health work. And on the basis of that, we work out strategy of replicating in the other hospitals. And then this team, which is doing the experiment, could train other hospitals, and it could be everywhere.
What we were going to do was we were going to give a grant for a one-stop crisis center to be established. We were going to provide funds for the hospital staff to be trained and for them to be able to begin to provide services. But then over 3 years of time, it would be up to the BMC to carry the work forward, which was great because it gave them a chance to think about it more deeply, more seriously.
The Deputy Municipal Commissioner, he was convinced, and he said that you go ahead. So the final proposal was prepared, and memorandum of understanding was signed by the 3 parties.
We've called the one-stop crisis center Dilasa, which in Hindustani means reassurance and support. So it's understood equally by Hindus and Muslims. Dilasa is the one-stop crisis center, which is equally owned emotionally by the Bhabha Hospital, the BMC, and Sehat.
I had many challenges in my mind. First of all, whether the doctors are going to accept it, and nurses and the labor staff, of course, union representatives. We have to really boost them up. It was a big speech I had to give. I said, see, those people standing on road had no backing, but here you have complete backing in the hospital to help them. This is the first of its kind, and everybody will remember you, the Bhabha Hospital employees.
There's about 882 odd people within the hospital. So as a strategy, it seemed a good idea to have a pool of key trainers within the Bandra Bhabha Hospital who could in turn then orient all the staff and do capacity building of the staff of the hospital.
And once this is over, we'll go to then police. We want to have a training for them.
What Sehat is doing now is saying that there is this one-stop crisis center that can address women's needs, whether it's the police, whether it's the law, whether it's the shelter, whether it's health services, in one place. For the first time in India, there is an actual entity that can address the issues.
It's been an eye-opener. You know, it's one thing to be working in a small NGO at the micro level, and it's another thing to be working in a large public system dealing with millions of people like the Bombay Municipal Corporation's doing. Because suddenly you find yourself on the same side. And you with added responsibility, because you can't stand outside and critique the system. You have to engage with the system in making it responsive, you know. We want to see it taking roots in the national health policy. But the immediate challenge is to really make it happen here.
Once people see the success of the project, I think many more would be ready to be a part of it.
So what I'm hoping is, with the beginning of this in one center, that it will expand and there'll be a demand at the community level to provide this service, and there'll be a demand by the NGOs to keep doing it well, so that services for battered women become an integral part of the health system in the country.